When most people hear the word fibromyalgia, two things usually come to mind: widespread pain and just soul-crushing fatigue. But honestly, that's barely scratching the surface. Today, we're going to pull back the curtain and look at the hidden side of this condition, all the strange, confusing, and frankly weird symptoms that often get dismissed, but absolutely deserve an explanation. So if you're thinking this is all about just being sore and tired, you are missing a massive part of the picture. There is a whole other world of experience happening just beneath the surface. Yet beyond those classic symptoms, there's another layer of sensations. And we're talking about things that can feel bizarre, sometimes really embarrassing, and are so often misunderstood. I mean, even by doctors. But here's the thing. These symptoms are real, and it's about time they were validated. So what does it actually feel like to live with this? Let's just run through a couple of these bewildering symptoms. As I go through them, just try to imagine experiencing this stuff, often with no clear explanation at all. Okay, first up, and get this, hair that literally hurts. I'm not kidding. It's a sensation called allodynia, and it's where the nerves in your scalp basically misinterpret a gentle touch, like brushing your hair or putting on a hat, as being seriously painful. Or how about this one, phantom smells? This is called phantosmia. It's where you suddenly smell something that is definitely not there. Could be smoke, chemicals, or even something gross like rotten eggs. It's basically a little glitch in the brain's sensory pathways. And then we have chronic hiccups. And I'm not talking about the kind you get for a couple of minutes. No. We're talking persistent, nagging hiccups or even throat spasms that can go on for hours. It's possibly linked to an irritated vagus nerve. And this one, sudden, intense yawning fits. Now, this has nothing to do with being sleepy. It's this uncontrollable, non-stop yawning that's actually a weird quirk of a dysregulated nervous system, trying to find its balance again. This quote from Melinda Miles just captures it perfectly. They're embarrassing, confusing, or just plain bizarre, and they deserve a name. It hits the nail on the head because these things aren't just physical, right? They can be so emotionally isolating. And just giving them a name, that's a huge first step. So what on earth is causing all of this? Why would a body produce such a strange collection of symptoms? Well, there's a simple but really powerful analogy that helps it all click into place. The key scientific term is central sensitization. All this really means is that the entire nervous system, the body's wiring, gets stuck in a state of high alert. It becomes hypersensitive and starts to amplify all the signals coming in. It turns the volume way up on everything, from a light touch to an internal feeling. It is not just about pain anymore. Here's the analogy. Think about your nervous system like a radio that's struggling to tune into a clear station. You know how sometimes the signal comes in perfectly, but other times all you get is distorted noise and static? That's pretty much what's happening. And that static is why the symptoms can be so varied, so unpredictable, and, so weird. So how does all this radio static actually show up in someone's day-to-day life? This is where the science really meets reality. Let's connect the dots. That scalp pain we mentioned, that's the static causing nerves to misread a gentle touch as pain. Those crazy temperature swings, feeling boiling hot one minute and then freezing the next, that's faulty nerve signals messing with the blood vessels. And the phantom smells? Just a misfire in the brain's smell pathways. See? It all comes back to that central sensitization. Now, understanding the why is a huge step. But the next big question is, what can you actually do about it? So let's get into the toolkit, some actionable solutions for managing these symptoms and, importantly, for advocating for yourself. Okay, this one is critical, being heard by your doctor. And preparation is everything. First, document your symptoms. Keep a simple diary. Second, be precise. Instead of saying, I just feel weird, try something like, I get lightheadedness when I stand up. And finally, explain the impact. Clearly spell out how a symptom is affecting your job, your sleep, or your relationships. That's how you turn a vague complaint into a clear problem that needs a solution. You can also take back some control with practical, everyday strategies. Pacing is a big one. Literally plan rest into your day. Create a little sensory kit for yourself with stuff like sunglasses or earplugs to manage sensory overload. Take control of your home environment with things like unscented products. And exploring mind-body practices like gentle yoga or even just simple breathing exercises that can do wonders for calming down an overactive nervous system. If you take just one thing away from all of this, let it be this quote right here. You're not crazy, you're tired. You're not making it up, you're doing the best you can with a nervous system that refuses to behave. Seriously, you're not making it up. These symptoms are the very real result of a complex neurological condition, and recognizing that is the most important step toward managing it. So really, the question isn't whether these symptoms are real. The question is, how can we all get better at listening to the people who experience them?